Good afternoon, everyone, and thanks for joining us today. In Regina, in the Legislative Building, we have Premier Scott Moe and Dr. Shahab. Joining us over the line is Dr. Rim Zayed, Medical Health Officer for Northern Saskatchewan. Premier Scott Moe will have an opening statement, followed by opening remarks by both Dr. Shahab and Dr. Zayed. Then we'll have about 25 minutes today for questions. Premier?
Well, good afternoon, everyone, and today we are reporting 12 new cases of COVID-19. 11 of those cases are in the far north. Sadly, today we are also mourning the loss of another Saskatchewan resident as a result of COVID-19. And our thoughts and our deepest condolences are with the family and with the friends at this difficult time. We know that there are now 72 active cases in Saskatchewan. Most of the regions of Saskatchewan, including Saskatoon and Regina, now have 10 or fewer active cases. However, over one half of the known active cases are now in one region, and that is in our far north. And most of those cases are in and around the northern community of Loche. On Friday, we announced additional steps that we are taking to address this situation and to protect the people of northern Saskatchewan. They included restricting travel in and out of our north. With regard to testing in Loche, the Saskatchewan Health Authority has already began aggressive contact tracing and testing of people who may have contacted people with COVID-19. The volume of testing supplies and the number of samples that are being transported for testing is being increased, and a GenExpert machine has been placed and will be operational in Loche on May the 1st. The Saskatchewan Health Authority will expand the number of mobile testing sites in Loche and support as well in-home testing. Drive-through testing will continue in the community of Loche, and they have obtained a list of people that have been returned from work camps in Alberta, and those individuals are being asked to self-isolate. On Friday, there were questions about how the virus entered Loche and how it spread, and I've asked the Saskatchewan Health Authority and health officials to work together to provide as much information as they can around what we know in that regard. So I will turn it over to Dr. Shahab to speak specifically to that.
Well, thank you, Premier. So first of all, I would also like to offer my and the health system's deepest sympathies to the family of the most recent COVID death. These are very difficult times to lose a family member and for the community as well. And we all recognize that the pandemic has placed significant burdens on those who are receiving care, whether in the hospital or home care or other care settings. So with the recent death, we are at 5 deaths in Saskatchewan, and this really underscores, again, our continuing vigilance to remain steadfast in order to observe all necessary precautions to prevent further transmission. This is especially important as we plan to reopen certain services in the coming weeks, because while the weather was very nice and it was nice to see people out and about, it is important that we practice social distancing unless we are within one household. And while there was a recommendation last week that our curve overall is flat, and we can now very cautiously think of maybe connecting with 1 or 2 additional households to make a extended household. But again, we need to be very cautious, even if we do that it is the same 1 or 2 people or same 1 or 2 families that we connected and not a random 2 or 3 different people every time. Because if we don't do that, our curve overall will not remain flat and we will not be able to continue with our reopening plan. So we all need to continue to observe the vigilance and diligence we've been doing to make sure our curve remains flat overall, and then that allows for other sectors to reopen and other services to start. But it needs our ongoing vigilance. Even as we enjoy the great outdoors, we have to observe physical distancing and all the other precautions that we have been doing so effectively. In terms of Loche, I just want to go in a bit more detail, and then I'll ask Dr. Rim to provide a bit of a summary. So, as I said, if you look at our cases overall, the majority of cases actually in fact, from today, 11 of the 12 cases were from the far north and 1 from the north. So if you look at far north, center, south, Regina, and Saskatoon, our curve remains flat in all the regions. But of course, we also have a challenging cluster of cases in the Loche, which are being managed very effectively by public health and the health system in the north, supported by the Saskatchewan Health Authority and other partners. And of course, this accounts for, in the north, most of the cases are accounted for the cluster that initiated through travel from northern Alberta. And then this again shows how quickly COVID can transmit. One or two people can generate 2 or 3 additional cases in a week. That can generate 2 or 3 additional cases, which is 9. Then if those 9 cases generate 2 or 3 additional, that's 27. So with a 2 to 3% doubling time, which is the RO, within 2 or 3 weeks, you can get into the dozens of cases, and within 5 or 6 weeks, you can get into hundreds of cases. So it is really important for us to continue to observe physical distancing all the time. And when there's a cluster and outbreak, it's a challenging environment, but that's where you need to then zone in and observe, provide extra direction around testing, rapid contact tracing, and further advice around, staying in place at home, minimizing any contact outside of your immediate household. So with that, I'll maybe hand over to Dr. Rim to maybe provide a bit more information around the situation in the Loche.
Good afternoon. Can you hear me?
Yes.
Yes.
First, I extend my deepest sympathies to the family of our most recent COVID death. I also offer my condolences to the entire Loche community, which I know will also feel this loss. As Dr. Shahab stated, we now have 29 confirmed cases in Loche and another 9 cases in nearby communities. We continue to work on contact tracing, which has been reaching out 70 individuals each day during this investigation. We are also working on expanding testing, both in collecting samples and the ability to do the initial lab analysis in Loche. I want to thank our staff for their hard work in both the contact tracing and the testing, assessment, and treatment of COVID patients. I also want to thank the leadership in Loche and Clearwater River for their assistance in reaching out to the communities as we work to stop the spread of the virus. We continue to look at how we can help patients who are positive or suspected to have COVID-19 self-isolate. We know that self-isolation can be difficult and challenging, and we appreciate the support of the First Nation and municipal leaders in this effort. This is really, we are committed to work together in this crisis.
Thank you, Dr. Zayed.
Great. Thanks, Doctor. We now have about 25 minutes for questions. We'll take our first question from the phone line, operator.
We have Mark Smith with CTV.
Hi, I'm just wondering how many tests, do you guys have a number on how many tests have been performed in Loche, and what's kind of the plan moving forward for testing there? Is the plan to test everyone in the community? How is it going to look moving forward?
So maybe I'll give some initial remarks and ask Dr. Zayed to expand on that. So whenever there's a cluster or an outbreak, testing is ramped up to assist in the case contact investigation. So anywhere in the province, if you have any symptoms that suggest COVID-19, you can, of course, and should get tested. But whenever there's an outbreak, there's a further focus on cases and contacts and settings. So if there's an institutional setting, testing may be recommended for everyone in that institutional setting. Contacts may be prioritized for testing if symptomatic or even if asymptomatic to get ahead of the outbreak investigation. So from that perspective, I'll maybe ask Dr. Zayed to expand a bit more on what's happening in the Loche.
So the average number of testing in the Loche right now is around 30 tests per day. Of course, we are working through every contact who shows symptoms. Like with the contact tracing, we monitor people every day. So there is someone who's doing the contact tracing, and another, we work as a team, and another one is working on phoning the family or the person who was in mandatory self-isolation every day. For testing, of course, as we there are increased, and this is expected again. People, this is a disease that is spread from person to person. So, so when people are getting the symptoms or are getting isolated, we test them, and with increasing number of tests and contacts, we have now an enhanced strategy is being developed for immediate implementation in the community of La Loche. The first component of this strategy includes increasing the volume of testing supplies being sent to the community and the number of lab samples that are transported daily. Expansion of the number of mobile testing sites will also occur, which will support home testing that we already implementing for people who are not having the ability or to attend a testing site. Drive-through testing is continued to work, but we are also in La Loche Center, but we are also supporting that with home testing, and we are also developing more plan for that to have like mobile units on a daily basis. There is also the Gene Expert testing machine will be operational in La Loche by May 1st. So we already got the testing, like the lab structure and everything to set up this machine, and this will make the turnaround time on lab results is really very quick on the same day, because we don't have to send samples by courier, and we can get really informed decision as of immediate. In the same time, there is a framework now based on evidence and science for the strategic testing for asymptomatic people is also being developed, and we agreed on a prioritization list. So that is the plan for La Loche for now.
Do you have a follow-up, Mark?
Yes, on a bit of a lighter note, Dr. Shahab, a fan Twitter account has been set up to honor you. I guess, what's your thoughts on that and your reaction to the response people have had to how you're doing?
That's very nice. So I was wondering whether someone would recognize me. I know many of my colleagues have been recognized, but it's always good to get recognition, and always good to receive positive criticism as well. I think it's a balance, and I welcome both, actually, both the positive and the constructive criticism.
We'll take our next question from the room. Arthur?
I was just hoping to get a more precise breakdown on those 29 cases in the community of sorry, you know what I mean, La Loche. How many are healthcare workers? How many are actually living in that long-term care home, and how many are just residents who have been affected otherwise?
Yeah, so I'll repeat the question from Dr. Zayed that, obviously Dr. Zayed may not want to disclose too many identifying details, but in general, if you could provide a summary of the 29 cases, how many were initially the index cases due to travel from outside Alberta, outside of Saskatchewan, from northern Alberta, and then the secondary transmission, how many close contacts and how many roughly were involved in the healthcare system and in other settings.
And are in the long-term care homes?
In the long-term care facility. So just in rough estimated number, Dr. Zayed, with the understanding that these numbers change daily.
So I would say that the 29 positive cases, confirmed cases that we have are travel-related. I would say that 26 are related to northern Alberta. There are two cases in the long-term care. Other cases in long-term care are negative, and we monitor them every day for any change of status, and we are continuing to support them as much as we can, including with the strict isolation precautions that are put in place. We are trying to get in touch with window visit for family, trying to get FaceTime, notepad, and iPad, things and how we can help with any innovative solution to help also support them mentally and socially. It's a challenging situation for sure, but we are doing our best as much as we can and in support with the community and the leadership of La Loche community.
And Dr. Zayed, I believe part of the question was on the number of healthcare workers as well. Do you have confirmation on that?
Yeah, for the number of healthcare workers, we have 2 healthcare workers, and actually with the implementation of again the isolation and contact precaution, as I mentioned, there is a cohorting of staff who are exclusively working in long-term care, and this staff also part of the infection control is to monitor this staff every day. If any staff shows like symptoms, they are not allowed to work, and they are also put on self-isolation. So, but for now, the 2 confirmed cases from healthcare worker are 2 cases.
Do you have a follow-up, Arthur?
Yeah, so we were told on Thursday that 10 may be a rough kind of threshold in terms of daily cases for when you might have to take a close look and determine whether there was a reason to sort of rethink the timing of the reopening plan. Where are we in terms of that? Do these cases and this new outbreak, does that make you rethink the pacing, even on a regional level for the North?
I think that's a really important point, and in fact, as of today, we have started generating our case counts by sub-regions in Saskatchewan. Obviously, initially, our case counts were very low and it wasn't of much use, but now it's really important, especially as part of the reopening plan, also to look at that very closely. So if you look at the north, yes, there were 11 cases in the far north, 1 in the north announced today. If you look at the curves, there are 0 to less than 5 cases in all the other parts of Saskatchewan on a day-to-day basis for the last 6 days. And we need to start looking at that in a longitudinal basis. So are the case numbers overall, what's the number? And then we have to divide them within the zones or sub-provincial regions to see what's the curve looking like there. And then even if we have, for example, 12 cases today in the north, it's really important to zone in on, is it a community-based outbreak? Is it an outbreak within a facility? And that is all important to then decide what further actions are required. So as Dr. Zayed described, right now there's an outbreak that's linked to a healthcare setting, but also within the community, and it's in the Loche area. So Dr. Zayed and other partners are working very closely together to try to control the outbreak in that community setting, but it's not throughout the north. It's just in that localized area. So I think all those factors are really important to, first of all, understand the curve overall, and where is it flat, where is it going up, and then what actions are required to further control it. I also wanted to take a minute to just emphasize why all 3 pillars of the public health response or the offensive response are important: physical distancing, testing, and case contact tracing. If we have 1,000 people today who get exposed to COVID, and let's say 300 are exposed, and 100 are infectious, and of those 100, we already know that maybe 60 or 50 or 60 are going to be symptomatic. So if you test all 100 people, you will get 100 positives, or less than 100 positives, because the 100 who are infectious, if you have fever and symptoms, your test is more likely to be positive. If you have mild symptoms or asymptomatic, there's a 50% chance that your test is positive. Otherwise, it may be negative. It doesn't mean that you're not infectious. So I think it's really important that when we talk about testing, that's really important to help us further define cases and contacts. But overall, we need to practice physical distancing all the time throughout Saskatchewan, even when the curve is flat. And when we have an outbreak, we need to even ramp up all those things in terms of staying home, going out only for solitary walks, reduce social mixing. And if, for example, there were 300 people who were exposed, testing everyone today would give you no idea about what happens tomorrow, because not everyone who is exposed becomes symptomatic or becomes infectious. So testing has a role, contact tracing has a role, but all this rests on the basis of staying home as much as possible, maintaining physical distancing when out. That's extremely important when there's an outbreak setting, and Dr. Zayed and partners are working very closely on enhancing that. But that remains important throughout Saskatchewan all the time, even though we go out and enjoy the outdoors, we connect with, one or two households and make virtual households to meet in groups of under 10. But those basic principles remain essential all the time because otherwise we can very quickly see a ramp up in case numbers anywhere in Saskatchewan.
We'll take our next question from the phone line, operator.
We have Adriana Christensen from CJME.
Hello, yes. My question is regarding a case of a report of an outbreak at the Confederation Inn in Saskatoon, and whether or not there is a count from over the weekend, whether or not there is a count of how many cases are there in that community, and if there's a concern that could lead to more cases.
So I'll confirm if Dr. John Marcobondo, who's the medical health officer of Saskatoon, is on to provide a bit of a update on that.
Okay.
Dr. Opondo, are you on the line? Doesn't sound like we have Dr. Opondo on the line, so.
So I can provide a brief update. So in Saskatoon, there is an investigation ongoing which was linked to individuals who were accessing health services and then linked to a residential setting, a hotel where individuals are staying. So that investigation is ongoing. And we have to understand that these clusters, unfortunately, will happen. They were investigated, precautions have been taken in terms of limiting further transmission, and extra precautions are being put in place around, which was already in place, but to minimize transmission, obviously in the healthcare setting, when you're traveling back and forth while receiving services, and if you're staying in temporary accommodation while you're receiving those services. So at this point, we can get some further information and updates on that, but my understanding is that cluster is controlled, but if we need to provide updates, we can. There's I think media availability tomorrow, we can provide an update on that.
Do you have a follow-up, Adriana?
I guess my follow-up on that, I guess, is if you say if there is a cluster up there, what the number is approximately in that particular cluster?
We will try to get updated information for tomorrow on that.
We'll take our next question from the room here, Steph.
Yeah, this is for the Premier. How could reopening the legislature in some way, shape, or form, whether people are in there or conducting business via Zoom meetings or committee meetings, how come that is absent from the Reopen Saskatchewan plan?
We have not discussed whether or not or when we may look at resuming some legislative services. I doubt whether, and I'm saying this off the cuff, that we would utilize platforms such as Zoom. We would utilize platforms that are likely have the security that the legislative work would require. So we just quite simply, all of our resources at this point in time have been focused on addressing the healthcare delivery of the COVID crisis, addressing how we are working with our communities to ensure that we have the proper and appropriate testing in place, contact tracing, ensuring that we are addressing this COVID-19 pandemic in communities right across Saskatchewan. As well as we possibly can. That's not to say that there won't be a discussion on whether we should at some point resume legislative sittings in some way, shape, or form, or committee meetings in some way, shape, or form in the months ahead. I would just add that there are no legislatures, provincial or territorial, to my knowledge, legislatures that are sitting across this nation, albeit there may be one or two that will sit for a day or two to pass some necessary legislation that they need to address their response to COVID. But as far as ongoing legislative sittings, they've all been either suspended or canceled.
Right.
Do you have a follow-up, Steph?
Yeah, I do. I mean, shouldn't you be considering opening up the legislature or having it resume in some ways? I mean, we're talking about businesses being able to open, people hitting the golf course. There's important work that happens in this building, so wouldn't this be a kind of high on the priority list of places you want to see open and resume business?
Yeah, it is important work that occurs here. There's important work that occurs at the committee level. There's there is a conversation that likely will happen there at some point in the days ahead. The fact of the matter is it has not occurred yet.
We'll take our next question from the phone line, operator.
We have Adam Hunter with CBC.
Hi, this is for the Premier. We're seeing and hearing a lot of reports of people not socially distancing this weekend, getting together in groups larger than 10, mixing. What are your concerns about that, and is the message getting through to people that they need to follow the rules that were set out?
Dr. Shahab may have a comment after me if he so chooses, but I would be very concerned. And I did hear of of one event that may have occurred this past weekend, and I would find that deeply disappointing on a number of levels that an organization would organize an event given where we are with this our approach and our collective, our personal approach, if you will, with physical distancing in community after community, in household after household, and how that has attributed to our collective success. And I would hate to see that be undermined in any way, shape, or form in any part of the province by individuals that are organizing large events, or in any way looking at ways to circumvent or get around the recommendations that Dr. Shahab has made. This success that we are currently enjoying is not guaranteed to continue, and it certainly is not guaranteed to continue if we don't take our personal responsibility very seriously by A, not organizing these types of events, and B, if there are large events that we just simply don't attend them as individuals. So I find that disappointing. We have had collective success in managing our COVID-19 outbreak numbers here in Saskatchewan in many, by far and away, virtually all of the communities in Saskatchewan. That is only possible by the personal choices that we have made, and I hope that the message is getting out, and I hope that people will continue to adhere to the recommendations that have been made by the gentleman sitting to my left.
You have a follow-up, Adam?
Yes. Given that the outbreak in Loche, I think it was said that it originated, partially in Alberta, and the number of cases that are going in Alberta, I think it's rising at a fairly high rate. Is there any consideration, or will there be any consideration for limiting travel to and from that province?
I'll make a couple of comments, and Dr. Shahab, if you'd like to add. As I said in my opening statements with respect to Loche specifically, individuals that are returning from Fort McMurray, we are asking them to self-isolate. As we indicated on Friday, that we have made every effort to work with the community to ensure that self-isolation is very, very possible and is the easy decision to make in Loche. We've moved a number of resources into the school for those that have tested positive, and for those that need to self-isolate and don't have an opportunity or an ample opportunity to do so on their own. We're providing as well an avenue to provide meals to those individuals in there. What we want to do is support the community in ensuring that every individual has the opportunity to do the right thing, not only when they have tested positive with COVID-19, but when they are being asked to self-isolate. And so we're working in lockstep with the community there in supporting them and the people of Loche.
We'll take our... go ahead, Doctor.
Yeah, I just want to re-emphasize a few points that the Premier made, and I just want to re-emphasize. So on the recreational side, it remains critically important that we enjoy the great weather we're having, but we maintain physical distancing and do not interact between households. So I think that is really critical. And so everything I saw the weekend was a lot of people were out and about, and they were observing that physical distancing, although it was much busier than normal. But again, I don't think we should be under any illusions that we're back to business as usual. This is enjoying the outdoors in a new normal, and the reopening plan recognizes that all the outdoor activities that will be allowed in the future recognize that you should not intermingle between households and or between individuals if you're out enjoying recreational activities. So I think that's a key point. Around workplaces and the reference to Alberta, we have also had cases or clusters in work settings that have been very effectively controlled, because even when people go to work while maintaining their physical distancing. So even if there is a case that presents at work, there are very few people who have been close contacts in the work setting, and then that cluster is effectively controlled. And I think Alberta has had some specific large outbreaks. We also have large complex workplaces, and I think even there, those workplaces are continuing to maintain high standards that ensure that there's physical distancing, people stay home if they're sick, and there's immediate case contact investigation and testing if cases present. And finally, as the reopen plan moves forward, we have to recognize that many people can and should continue to work from home. If you can work from home, you should continue to work from home. And the reopen plan really allows for other retail sectors to open up in the same safe manner that, for example, grocery stores and other sectors have demonstrated that you can open up and provide a service in a safe manner. And for other settings that are not public facing, those workplaces can open up in a way that, like other essential workplaces, that physical distancing is maintained, special attention to breaks where you have to be extra cautious when you're having meals or using the washroom, where you don't transmit inadvertently if you were asymptomatic but infectious. So I think all of those mechanisms need to be followed very closely, because we are moving forward into a new normal and not certainly going back to business as usual. Thank you.
We'll take our next question from the room. Wayne?
In relation to events, which we just discussed here, Canadian Western Agribition today announced that there will be a show in November. Would that still be subject to whatever the situation is at the time and the guidelines, or are they under a essential services farming type of exemption? And also wondering about small communities, perhaps even Shelbrook, they may be planning a summer fair. Should these volunteer organizations be thinking about summer events, or is it too early to be doing that?
Yeah, so I was able to get home this weekend, and the question that came to me from people very close to me as to whether or not they're going to be able to have sporting events this summer, softball and such, and whether that would even be possible. And then with that comes some of the tournaments and things where you do get larger number of people together. Large gatherings are a high-risk area for the spread of COVID-19. That has been proven time and time again, whether it's a curling bonspiel in Edmonton, whether it's a snowmobile rally not far from where I live in Christopher Lake, or I believe it's Christopher Lake, or whether it's a large funeral in Newfoundland and Labrador. This is a high-risk area for the transmission of COVID-19. So we have not made decisions on large events out in the months ahead. However, maybe it is worthy of a discussion, and we would reach out to a number of those event organizers, the CFL, for example, as we are hosting the Grey Cup here. And I always want to mention that irrespective of whether that occurs this fall, the Saskatchewan Roughriders are the heavy favorite going into this year's Grey Cup. But there's other events as well that have been asked about with respect to the Country Thunder. Every small community does have some degree of either a July 1st or an rural ag days like we have where I live, that involves ball tournaments and a number of people coming together. So for the short term, those events just aren't possible. Short term being the next a couple to few months. And after that, I'm actually becoming less positive that we will be able to gather in these many thousands of people in any event for the foreseeable future. So Dr. Shahab, you might have something to add to that, but the short answer is we're not sure in the months ahead, in the medium term, but we may have to have a discussion about that soon.
Yeah, I mean, what I would add is that we all saw how effective the very high level of physical distancing and other public health measures were over the last 6 weeks. So that is evident. Now we are very cautiously relaxing some of that, but we have to make sure we succeed in our phase 1 and phase 2 before we start looking at future phases. And but having said that, there may be some really innovative solutions that event organizers can propose for consideration by local and provincial authorities that may minimize some of the risks, but may let some events to proceed in a way that at least lets people recognize that these are, valuable cultural and economic and social events. But they would have to be done in a way that minimizes risk of transmission, because we all know that in these large gatherings throughout the world, there have been large transmission events. And if that was to happen in Saskatchewan, it would take us back to where we potentially could have been if we hadn't put all these steps in place. So I think we need to give some careful consideration, and I think move in a very stepwise and systematic way.
You have a follow-up, Wayne?
I guess I've also had questions from churches wondering if there might be an innovative solution where maybe for phase 5, where theaters are allowed to reopen, if they could maybe have a gathering of 30 people or, smaller in number, multiple, repeated, and like 5 services a day, for example. Would you be open to that type of innovation, or, because right now they're post-phase 5, post-phase 6, I think, or whatever the last phase is?
I think what I would say is that I think we really need to move cautiously, and we know that from the last few months, from not just Saskatchewan but other settings, that when people gather around food, when there's hugging, when there's singing, shouting, crying, tears of happiness or grief, when all those communal events that are natural to all of us as human beings and as societies, but when they happen, transmission happens, and I think we need to think very carefully, how can we move forward as a society for the next several months in a way that we keep the curve flat till such time that there's therapeutics or vaccine or other interventions that get us out of this, and which would be many months in the future. And then, but at the same time, how do we then reopen our society in terms of work and maybe in the future school and other settings for learning? But it will have to be very different from how things were 3 or 4 months ago. And I think we need to move very cautiously, and there will be a time when we will consider, increasing the gathering size, but we'll have to apply specific learnings from the past and what we learn over the next few weeks and months to those opportunities.
How would a church, though, or mosque, or a synagogue gathering be different than a movie theater or arena, which is allowed to open in phase 5?
Yeah, no, I think those are good points. That I think I have thought in my mind that if you were in any setting, congregate setting, where you were separated by 2 meters on all sides from others, would that be a safe way to attend a gathering? But then you have multi-touch surfaces. You have risks if there's food being handed out or other items being handed out. So I think all of that needs to be thought through. But I think we need to give some time for the phase 1 and phase 2 succeed and show that we are keeping the curve flat before we start thinking about that. But I think those are important things that we all need to start thinking about and have been thinking about. But we have to move in a very careful and methodological way.
Well,
I would just add to that, Wayne, with respect to each area, like churches versus movie theaters versus other events. There's some differences between all of them, and I know the church that I go to is now moved online, and so we watch that on Sunday mornings. But in our church there's an age differential from kids of newborn and 2 and 5 and 10-year-olds to very young adults, which is where I still classify myself, but my wife reminds me that isn't the case anymore. But all the way up to 80, 85-year-old individuals that will be attending at the service. So we have all different dynamics of the community coming together. So is there, is there understanding, the risk of each of those, for example, age demographics, never mind the underlying health issues that people may have. Is there an opportunity for an innovative conversation post phase 2 or phase 3 on how we may be able to come together? And I think it's important that is our goal, that we do come together as a community, whether that be a religious community or a geographical community or a sporting community, and all of these conversations are good for us to have. We do need to get through phases 1 and 2 and keep our curve in general flat. I think before we're able to have those innovative conversations about how can we have some proper physical distancing in some of these group size gatherings, and then what is the right number, and how do we work with each of the segments of our population so that we can have a new normal, if you will, in how we are conducting our life and getting along, supporting one another, yes, coming together as much and as best as we can, but most importantly supporting one another while protecting one another at the same time.
We'll take our next question from the phones. Operator?
We have Roberta Bell with Global.
Hi, my question is regarding some of the First Nations, particularly the ones in the Loche area. They were saying they were having unique challenges with gatherings and enforcing social distancing. I was wondering if there's any plans to help them through that, as well as any plans to, build some sort of First Nations framework, which didn't seem to be in the reopening Saskatchewan plan.
Okay, with respect to the Loche area in particular, and there's 3 communities in there that we are directly or indirectly working with. There's the Clearwater River First Nations community. We have Loche themselves, as well as Patchinook, and we've worked very closely with Loche over the last number of days, beginning some equally important work with the community of Patchinook. And I had flagged this with the Deputy Prime Minister this weekend when we chatted with respect to the Clearwater River First Nation and how we can collectively support each and all of these communities. Some of what we are doing specific in that region, understanding that in the province now we have 72 total active cases, 42 active cases in the far north, and 38 of those are confined to that Loche and the communities around Loche. We are providing a significant amount of resources into that area, not only in the way of testing resources, which were spoken to earlier, the contact tracing resources, which were also spoken to earlier as well, but we are providing supports directly into the community, supporting with in their emergency operations center to help formulate the plans of communication around physical distancing of people in that area, as well as doing advertising or informative communication messages in 4 different languages on the radio in that area. We have offered supports and are continuing to work with the 25 municipalities in the north that are working at procuring some of the checkpoints, if you will, for people coming in and out of the north, and so we're working very closely with the northern communities on how do we fund essentially some of this work that is happening. So not specific to, in this case, to Clearwater River, but I do know that that the chief of Clearwater River, Chief Teddy Clark, as well as the mayor, Robert St. Pierre, and the Loche have been working quite closely together to ensure that the supports that are needed are being offered in that area. And Leonard Montgrand as well with the Métis Nation.
You have a follow-up, Roberta?
Yes, is there any plan to address the, cross-jurisdictional or multi-jurisdictional nature of reopening Saskatchewan vis-a-vis reserves and the settlements in the nations, and the kind of unique challenges with the 3 different levels of government when it comes to opening them back up? Is there a plan to make a plan to help them through that?
Well, the plan that we have can apply in First Nations communities as well as any other community. I've talked with Chief Cameron with respect to working closely together, not only in how we reopen the economic side of this province up, but how we continue to service the communities in the province. To date, many of the First Nations communities, with respect to governing the access in and out of those communities, most, if not all of those communities have chosen to and are comfortable with governing or with managing that access in and out themselves. They have received some funding from the federal government so that they're able to do this. So we keep in close contact with not only Chief Cameron, but other First Nations leaders as well, not only in the north, but across the province.
We'll take our last question from the phone line, operator.
We have Dan Jones with NBC.
Afternoon. This question is overall to the SHA. In terms of the level of transparency we've been seeing coming out of the Loche, it seems that your information has all been really dated and behind in terms of what the community is saying on Facebook, and even yesterday with the death of Mr. Silvestri. When can we expect increased transparency with the SHA on cases in La Loche?
So maybe I can make some comments, and I think then we should take this question to the SHA for tomorrow. I would like to say from my side that the level of transparency that certainly that I see has been unprecedented in terms of a rapidly moving issue, which is COVID-19, and being transparent against around case numbers, what's happening. But we have to understand some fundamental things. We always have to confirm that the family is informed when there is a death, for example, before we announce. So there is always a bit of a lag in that. We always have to protect the privacy of individuals. even if there's information on social media that may identify an individual or community, we always have to protect the privacy of individuals as much as we can from our side. Having said that, when there's an outbreak or cluster which requires people have to, be informed so that they can take further precautions in that community setting. Of course, while I've said in the past that individual cases who are isolating at home, there's no point in announcing where a case lives. But when you have a cluster outbreak that impacts day-to-day lives of people living in that community, of course, that has to be communicated to all residents of that community. For example, to make them further aware of symptoms, to seek testing where they otherwise may not have thought about testing, and other advice that may be required to limit the spread in that setting. So, I think from my side, I would like to say that we, while protecting individual confidentiality, I think we want to be as transparent as possible because the public is our partner in this. This is not something that is being managed. The health system is there to manage illness and is doing that very effectively. The public health system is there to support testing, case contact tracing, but ultimately the most important pillar of the COVID-19 response is our individual actions, and they have to absolutely be informed on a day-to-day basis by the information that we are seeing that has to be communicated back. But certainly, while we protect confidentiality, we are always open to receiving specific ideas about how to improve the visibility of that information as it informs our actions as individuals, as communities, as employers and employees, because there's so many sectors where you need to have good current information. But the bedrock of that maintains what I've said earlier. Physical distancing as an action that we have to continue practicing has to remain in place no matter where our case numbers are in terms of the area of Saskatchewan where we live. Thank you.
Do you have a follow-up, Dan?
Yeah, just briefly here. Can the gentleman that's all not muted who's coughing, can you please mute your phone? The answers are getting muffled. Last Tuesday, Dr. Zaid said that this COVID outbreak in Loche was under control, and 3 days later you guys issued a no travel ban order into Loche and really the north. Is this under control?
So again, what I would say is then, and I'll maybe ask Dr. Rim. So when you have an outbreak in a complex environment, whether it's a complex workplace or in a community setting, there are always challenges to get ahead. And I think in the past, where there has been an opportunity to quickly move and identify all cases and contacts, we have been able to control clusters. In many settings, it has taken some time and some additional efforts in terms of case content investigation, testing, that's surge response. But it can be very challenging. And again, I would like to say that it needs everyone's, the whole community needs to come together, and in terms of staying home as much as possible, minimizing household to household interaction to really put an end to a cluster and outbreak. So with that, I'll ask if Dr. Rim is still on and she would like to add any general messages from the Loche or Northern Saskatchewan perspective.
Yes, in terms of the outbreak and what is meant by an outbreak under control is that when you do the contact tracing and you find you link this the contacts, the cases that you find with a certain known cause or an unknown cause. So until now, all the cases that we have found are known. We didn't have any case that are not linked to a specific link. So we have a good mapping of the cases. In the same time, I previously emphasized that we will find new cases. This doesn't mean uncontrolled. This means that we anticipate new cases based on the different incubation period and the different exposure of people, and the more testing that we do based on our contact tracing. So we are expecting to have new cases. As any other outbreak or cluster that happen, you will always find these new cases, and then you will refer them or link them to known or unknown reasons. So when we find that there is known link, we are tracing the case appropriately, And whenever we find new cases, they have been already under isolation. So that was really a good direction, that we are on the right track. The other things about, also I want to emphasize about transparency, there is no reason not to be transparent. Our relation and the communication with the community is on a daily basis. Their communication through social media every day was related to number of cases, and as Dr. Shahab mentioned, this is also in cognizance with patient confidentiality and transparency. But we really are trying and committed to transparency.
We'll take a couple last questions from the floor. Arthur?
I've heard a report that the acute care side of the health facility in Loche has been closed down. Can you confirm whether that's true, say why, if it is true, and explain what people who may have COVID-19, what will happen to them given that there's no acute care?
So I'll see if Dr. Zayed has any thing to say. Otherwise, we'll have to bring it to tomorrow, because I'm not aware of any specific details. But Dr. Zayed, did you hear the question?
No, I didn't hear the question.
About the acute care facility in Loche, is that still functioning normally, or are there some restrictions there?
No, there is restriction. We are restricting the admission on long-term care only. The acute care admission, the emergency department is still open, and the referral is done to Isla Croft Hospital.
We'll clarify that for you, but it sounds like there's no admissions on the long-term care side, but there is an acute care side.
Acute care is working.
That's what I heard.
Normally.
So,
follow-up, Arthur?
One follow-up here. Just to kind of come back to the first Adam question that we had there about people gathering over the weekend. We were talking to the opposition leader today, and he to some extent connected that to your comments from last week, Premier, about barbecues and some things that you said on CBC. I'm just wondering if you think you do bear any responsibility, whether you could have been clearer, and if there's anything you do want to clarify with regards to how people should be gathering.
I say exactly the same things today that I said last week and that I said on CBC, as I mirrored some of the comments that Dr. Shahab had said, where we can start to expand our households here in this province, and we can, with great care and ensuring that we are adhering to physical distancing measures, expand that household so that we're able to visit maybe a family or close friends in preferably in an outdoor experience where there's 2 meters of separation, where you aren't close and you are able to have that visit with. And I think I'd use the example of being able to see one of my family members that I haven't seen in likely over 6 or 7 weeks now, and I didn't have the opportunity to see him this weekend. We should have the opportunity to very carefully and cautiously start to see some people that we haven't maybe seen for some time. We have people that haven't seen their family members for much longer than in my case. The fact of the matter is we just need to be careful with respect to our physical distancing. We need to be careful with respect to how many people we are seeing over the course of a week or two. And I think I had also used the example, if I remember correctly, that we should be able to list the people that we have seen over the course of the last 2 weeks. That is the list that if you were tested positive, that is the list that the contact tracing people would be looking for. You should pay attention to that list, and you should know what it is. And if it is getting somewhat too long, you should allow that to govern who you are going to see in the next number of days. That is how we should conduct ourselves with personal responsibility with respect to physical distancing, with respect to how many people we are interacting with over the course of a day or a week or a 2-week period. I would hope that people would take those comments to heart. There is an opportunity for us very carefully and cautiously to reconnect with people that are important to us. But if we push this too far into a large gathering, for example, of which I never did indicate, never and will not indicate at this point in time is safe in any way, that would be a misinterpretation of what I said, because what I had actually said is we have the opportunity to expand our household in a very careful and cautious manner, obeying the physical distancing methods that are in place. This is on us. This is on each of us as individuals. For us to continue with the collective success that we have to conduct ourselves with a very high degree of personal responsibility when it comes to physical distancing. It's unfortunate that the Leader of the Opposition would portray them that way.
We'll go to our last question from the floor, Steph.
Yeah. Mr. Premier, do you see any equitable or equity issues with moving ahead with a reopen plan when half the province is under kind of a no travel advisory and they are dealing with an outbreak? Do you foresee that we could be in a situation where northern Saskatchewan businesses can't open, people can't really leave their homes, but southern Saskatchewan, an area that typically has more services and people are doing better off than our northern residents, will be free to go to barbecues and whatnot?
Yeah, no. So no, not at this point in time. The first phase of restrictions that will be lifted will be in essentially the expansion of some of the healthcare and personal services that we have, and we'll wait a couple of weeks until the second phase would come into effect. This allows us some time, not only between now and when the first phase does begin, but even now and when the second phase, when those more retail-based businesses might come into play, to have a discussion and to see where our numbers line up in the north. Right now, we have 42 of our active cases, of 72 active cases, are in the far north. Of that, 38 of those 42 cases are in a few communities up in the northwest. So we will have a conversation. Is there an opportunity for us in the week and 2 and 3 ahead to start to clarify where these travel restrictions are, and we'll continue to work with community leaders as there may be an opportunity to actually clarify and really bring those restrictions into the area where they are necessary. So what we have done here today, I think, has gotten everyone's attention, or last week has gotten everyone's attention, and that isn't that is a good thing to ensure that we are practicing, no matter whether you're from northern Saskatchewan, southern Saskatchewan, or wherever, proper physical distancing. So we will have that conversation in the time ahead to ensure that we are addressing the regional outbreak, and I've said that we will need to make efforts to address regional outbreaks, and this likely will not be the last regional outbreak that we have. Address them very aggressively with testing, with contact tracing, but also with isolating, so that does not become a provincial outbreak, if you will. And this is very much a similar approach as we would take to if we had a regional outbreak in an area where, and we were trying to clarify in another area of the province, and we were trying to lock it in, if you will. So this is a work in progress, if you will, and we'll continue to work on narrowing, I guess, our approach to the area where it needs to be narrowed to, as well as providing the supports into that area. And we provided a number of supports directly into the community of Loche. As I said, we're beginning discussions with the community of Pachinak, both communities where we have jurisdiction to operate, and to operate with the community and to provide resources in the way of ensuring that self-isolation is most certainly possible and easy to access, as well as other supports that the communities might need. So this is not something we've done before.
You have a follow-up, Steph?
This is going back to an earlier question about travel restrictions in Alberta. I didn't get the sense that there's any consideration for introducing stricter travel restrictions or putting some kind of like highway patrol or something a bit with more teeth than we have now. How come that isn't the case? Because it kind of seems like the obvious thing to do, and you yourself have said that as we move forward with this reopen plan, travel is going to be the thing that you really have to clamp down on. So, and Alberta is seeing way more cases than we are, so why not something stricter along that border?
Because the curve is essentially flattened in many areas of the province. We have this outbreak in the Loche and Pachinak and Clearwater River areas where it has come in from Alberta. So we are approaching it very aggressively in that particular area. As I said, we're asking those that are returning from Fort McMurray to self-isolate for 14 days in that community, as it seems to be the vast majority of the cases that we have in that community have came through that method of contraction, if you will. but the rest of the province has seemed, for one reason or another, been able to flatten the curve.
And before we wrap up today, there was a question earlier regarding the Confederation Inn in Saskatoon regarding how many cases have been confirmed as part of that outbreak. We do have Dr. John Mark Opondo, Chief Medical Officer with the Saskatchewan Health Authority in Saskatoon, on the line. Dr. Opondo, would you like to give a brief comment on that?
Thank you, and I have to apologize for the technical mishap earlier on, but starting off with sharing my condolences with the family and the Loche community on their loss. So the Saskatoon aspect of this situation is we have had a cluster of cases in the city of Saskatoon for individuals who live together. So it's a community outbreak. There is 4 in total who have a home address that links them back to La Loche, but some of them haven't traveled recently. A few of them have. There's no immediate connection at the moment with the La Loche contact investigation, and likewise on the Saskatoon side, we are doing quite a widespread community investigation as well around these 2 cases, around the 4 cases that have been reported. All these cases have been asked to self-isolate at home, and they've been very compliant, other than the first 2 days when we found the first case and the next 3 cases were named as contacts to the first case. We've continued to do contact tracing in more than 20 other contacts who were named and haven't found any other cases. So I feel this investigation is well underway, and the patients are stable, they are isolated, they're very compliant with social distancing and all the other public health measures. So we think this is going in the right direction. Thank you.
Perfect. Thank you, Dr. Opondo, and thanks everyone for joining us today. That's all the time we have.